Sorry for that quick little delay there. So, welcome to What the Fits. You can't hear me? Oh my goodness. This is not.
Yes, we can.
You can. Okay.
Yeah.
I can hear you, Jen. All right. Thank you. I appreciate that. So, anyway, welcome to What the Fits. Light and laser treatments to treat all skin types. Get started here. So, a little bit about me. My name is Jennifer Aponte. I am a physician assistant. I'm a co-owner and a provider at ProMD Health in Columbia, Maryland, and also now Lafayette, Colorado. Not working out in Lafayette, but part owner of that new location. We in Columbia were the first ProMD franchise and opened our doors in January of 2020. I'm a proud wife and mother of 5 children. We're all adults at this point. I graduated from the University of Maryland in College Park in '97, and I studied dietetics and then went on after raising my kids, at least to elementary school age, went back to school to get my PA and master's from Anne Arundel and St. Francis University in 2012. I worked in OBGYN and in occupational medicine and urgent care for approximately 8 years before I got into aesthetic medicine. And I've really developed a passion for lasers, so I wanted to share information with you and hopefully answer some questions about what we can do with lasers and who can benefit from them. I do love everything we do at ProMD, all the injectable treatments and all the other, aesthetic stuff. But I think that I've just really developed a respect for light and laser treatments and what they can do and how impactful they really are. Results are so, they're long lasting and very thorough. And I've also learned that a lot of people just have a lack of understanding about them and what they can do and, whether or not they're even a candidate for them. So again, about ProMD, we're in a medical aesthetics practice and we specialize in non-surgical treatments and focus on anti-aging and wellness. And our goals are always to try to achieve natural looking results. We do, of course, injectables with neuromodulators, filler, Sculptra, and other, modalities, Emsculpt, medical weight loss, hormone therapy. We have a spa, and of course, what we're talking about tonight with the lasers. So the first thing I wanted to do was go over the skin types so that we have a better understanding of what that means and how that basically helps us determine what we can do for different skin types with these lasers. The Fitzpatrick scale is a scale that was developed in 1975 by Dr. Fitzpatrick, and it categorizes human skin tones based on the response to sun exposure. And this helps us determine risks with these lasers because it can basically help us decide whether or not a laser treatment might be too intense and cause potential problems such as hyperpigmentation. So we know, appropriate settings and which treatments would be best for our patient. So I'll go over the types really quickly. Skin type 1, very fair, red hair typically, or blonde and light eyes. Freckling is very common and typically burn pretty easily and pretty much never get the tan. So examples would be Irish, Scottish, English descent. Type 2, still usually pretty fair with lighter hair, maybe light brown hair, and then also typically still light eyes. Burn still pretty easily and very rarely can actually get a tan, but slightly more than a type 1. European is typically background. Type 3 would be brown hair or just a darker blonde, all different eye colors, could be brown, blue, hazel, green, gray. Skin's typically still pretty light, but somewhat light brown for some with a little bit of an olive tone. Do burn still, but eventually turns into a tan. That's kind of the key when I ask that question. People say, yes, eventually I might burn, but it'll become tan. And these examples would be German or Southern European. Type 4 would be brown hair, brown eyes, maybe hazel, but typically brown, and skin hardly burns, usually tans pretty easily. Examples here would be Mediterranean, some Asian, Hispanic, and mixed race. I'll get to the mixed in a minute. Type 5, usually darker brown hair, brown eyes, tans easily, rarely does burn, and usually tans pretty quickly. This would be Middle Eastern patients, Asian, Hispanic, and again, mixed race. And skin type 6 would be black hair with brown eyes and pretty much never burn, tan very, very easily. And then these are some examples here with African American, Caribbean, Dominican, and darker skin Asian. So, these are classifications that, we use, but we still have to ask questions. I always ask patients about their heritage. I ask about the, the sun, how they react. And then, if we have mixed, your mom's from, one place and dad's from another, usually the safest way to go is to go with the more conservative, which would be a darker skin typing, just to be on the safe side. And why this matters is because, like I said, the amount of melanin in the skin, the darker our skin, the more we have to think about potential risks with these treatments. Lighter skin can tolerate more aggressive laser settings. The darker skin types have more melanocytes, which are the cells that produce the melanin, and they absorb light and release this energy as heat. So would be more prone to this PIH, which is post-inflammatory hyperpigmentation. So we need to use lower energy settings and use cooling mechanisms such as a hose we have called a Zimmer that keeps the skin cooler in order to hopefully avoid that potential risk. Melasma, which is a skin condition that's extremely common, is caused by an overproduction of melanin, but this is often triggered by things such as hormones and sunlight, and often heat can also trigger this. So, any of these things we have to think about when we're doing these treatments. Fitzpatrick, is basically like I said, a scale that we use for a guide, but we have to, read the skin. We have to actually look at it and, ask the questions too, to make sure we get as close as we can to the correct type. So some laser terminology I just wanted to go through before I dive in here, just to help hopefully the following slides make more sense. Broadband light, you may have also heard of, referred to as IPL. IPL is intense pulse light, and this delivers a light energy, and that stimulates collagen production, and we're able to eliminate darker skin cells, so pigment in the skin and redness, the people that have visible redness on their cheeks or nose. And broadband light is just a more advanced version of IPL. It's more precise, and we can target very specific concerns with it. And it's more comfortable, and we require fewer treatments using broadband light over IPL. Ablative laser is one that would use a laser beam of light that vaporizes the top layer of the skin, so it's actually breaking the skin, and that triggers the body's natural healing process so that we get new, smoother skin in place of it. So we can use lasers like that to improve, deeper wrinkles and lines, acne scarring, and deeper sun damage, and even out some texture. Non-ablative lasers also use laser light, but they target water molecules in the skin into deeper layers. So this doesn't disturb the outer layer of the skin, and that means a gentler treatment with less heat and injury. And then fractional laser is a term that basically explains how the laser hits a fraction portion of the skin at a time. So it's not hitting every square inch. If you think of a square and then a bunch of little dots in that square, those are the fractional parts of the skin that are being treated by that laser, which leaves some skin untreated, and that allows better healing with the help of that skin that hasn't been treated surrounding it. So the lasers we have, all these different options and technologies. So we use, basically we have to understand what we're trying to treat, and then decide which of these modalities is the one we want to use. So in our practice at ProMD, we have Cyton light and laser equipment, broadband light, the IPL I was talking about. So that's one we would use for pigmentation, redness, to treat acne, and we can do hair removal with it. Halo is a hybrid fractional laser, and hybrid meaning we can treat surface and deeper skin. And this helps with pigmentation, fine lines, and wrinkles. Moxie is a gentle, non-ablative laser for early signs of aging. It's really great for younger people that are wanting to just start to get into this, to try to help polish the skin and get rid of, lighter pigmentation, don't necessarily have deeper lines or wrinkles they need to treat, and really want less downtime. It's also ideal for treating melasma, and it is great for all skin types, Fitzpatrick 1 through 6. The nano laser and micro laser peel are a resurfacing treatment that we do that is basically removing ablating skin that, we control the depth. So we can do a nano, which is extremely superficial, and then we can keep increasing that depth into deeper depths to get, a deeper peel. So much like a chemical peel, this is peeling the skin off, but it's actually doing it immediately versus chemical peels where, you apply the peel and then it peels a few days later, which in that case, we don't have any control of how deep it's going to actually peel. Contour TRL would be the deepest resurfacing laser that we have. So this is something we would do with much deeper wrinkles and textural needs. It can really help stimulate collagen and really get rid of damaged skin. It's typically used on my older patients that just need that bit more of resurfacing. I wanted to touch on laser season because it's a term that's used a lot now. I wanted to go over what it means and why we call it that. There is definitely a time of year, basically from fall through spring, when we definitely see an increase in light and laser treatments. And this is obviously due to less time being spent outdoors and sun exposure, and everyone tries to avoid the sun when doing these things. But we do have lasers that can be done year round. Moxie is one in particular because it's not ablative. It's definitely safe year round. And I really think that, everyone should, realize at least that it is okay to do lasers year round. I have plenty of people that do, because a lot of people now are avoiding the sun, as you should, using sunblock. And as long as you're not exposing your skin within, a short period of time, once it's been treated, then it's not going to be harmful. We do not do broadband light, the BBL treatments, on suntan skin. So if I have someone who's been on a boat, and last week, I'm going to tell them to come back in 2 to 3 weeks when their skin doesn't have any sun on it, just for safety reasons. But it is okay to do them year round, especially Moxie. So I'll start with broadband light. This is safest for Fitzpatrick 1 through 4. It can be used on 5s, but I just tend not to. I find it's difficult to do it, comfortably for the patient. I've had a few have some success, but that's a rare treatment. I typically stick with just on Fitzpatrick 1 through 4. But broadband light is actually pretty amazing. It's been found to basically reverse age of the cells. And then it also is capable of halting precancerous cells from further developing into cancer. So I have a few patients who've had multiple skin cancers removed and have started doing broadband light treatments regularly in order to fend that off and slow it down, hopefully stop developing these skin cancers. So it's pretty amazing. But we can remove sun damage, sunspots, redness. It's perfect for people with rosacea. It's one of the only things that really works. There are topical treatments that do something, but broadband light can really eliminate it. It's pretty amazing. The vessels that you tend to see, the little red vessels around the nose and on the cheeks, those are perfect. With broadband light, we can get rid of that. Acne, as you can see in the top left picture, I have a patient there who was about to go on Accutane. And we just did broadband light. She didn't use any topical treatments otherwise and did not take any medications. That was achieved after a number of sessions. But that's, it's amazing the difference it can make. And we can also do hair removal with it. You can treat the entire body, face, neck, hands, body. The bottom picture there is my chest before and after. That was I think it was a 7-day later picture on the bottom. So it's fairly immediate. Within a few days you see the pigment go away. Then the gentleman in the middle, I used this one to show the difference in the redness, because he did have some rosacea. He also did a halo on top of that. So, you get textural improvement with that. And I love stacking treatments like that. I'm going to show here real quickly. This is just a quick snippet. That's what the BBL looks like when we do it. A little bit of flashing light and wear goggles. I put a gel that's cooling on the skin, and you can feel mild pulses. They're typically, warm. Most people don't, have too much discomfort with it. And the whole procedure takes about 20 minutes, maybe up to 30 minutes. So I don't know. I don't have the title on this one. I don't know what happened to it, but this is the Halo. Halo is safe for all Fitzpatrick types. It is a hybrid laser, which means I have 2 different wavelengths I can set. One that's going to hit superficially and do that ablating, and the other that's going to go deep down. I'm sorry, reverse that. The deeper one is going to do the ablating. So we're going to both get textural improvement as well as, removal of sunspots and superficial things. So you get improvement in fine lines and wrinkles. We can treat scars with it. It's really great for acne, scarring. It helps reduce pores. And the nice thing about Halo is that it's very customizable. So I can, do different things with it. If someone just has real superficial pigment they want to get rid of, I can set it for that. If someone has deeper wrinkles and scar issues, I can, really go more dense of a treatment and a deeper treatment in order to improve that. The patient in the middle here, the bottom with all 4 pictures, we did a combination of Moxie and Halo, and the Halo was done on her cheeks, and you can kind of see on the bottom left part that's where the dense treatment was done for acne scars. So we didn't need to do the Halo in her entire face. We were able to do just that part, and that reduces our risk potentially of heating up too much and causing some hyperpigmentation. She's a skin type 5, so I definitely wanted to make sure we didn't heat her up too much, but outcome was great. And this can be done on the body as well. You can do hands, chest, all different places. And the Halo glow that everyone gets is visible for most people by the 7th day, and it's really a nice treatment without a whole lot of downtime. So this is just showing the procedure here. We applied numbing cream for an hour. We use a Zimmer chiller for comfort. So that's just basically cold air conditioning coming from a hose. It takes about 30 minutes. It's really pretty comfortable. And you just have some prickly heat for a few hours afterwards. Your face just feels hot, and it dies off pretty quickly. So it's really pretty tolerable. And then, like I said, 7 to 10 days later, you see your outcome. So this is Moxie, safe for everyone. Like I said, it's non-ablative, so it's not actually ablating any skin, and that means it's a little more gentle, but it's really great for stimulating collagen. It's really great for, removing pigment, and especially for melasma. And melasma is quite a tricky condition to treat. So it's really great that we have this modality to use. We do put numbing cream on as well. I'll show you in the next slide the steps with this one, very similar, but this one is extremely fast. They call it the lunchtime laser because you can actually do it in under 10 minutes. And it's, like I said, it's great for everybody to get that nice glow and remove the pigment. This patient in particular has both dermal and epidermal melasma, which just means deep and very superficial. And the difference can be, getting it out just can be challenging. But you can see in the picture on the right that a good portion of that pigment you see around the mouth and on the cheeks came out. So pretty amazing. So like I said, numbing cream's applied for an hour. Some people don't even do the numbing cream because it's so fast. We just give you Pronox, which is laughing gas, basically, that you inhale, and it relaxes you. And then again, you have that prickly heat for about an hour afterwards, but it just stops after that hour. Pretty easy. This is showing it. I don't have sound, I don't think, but you can see it's very similar to Halo. But you can see how the skin gets a little red, and that's really it. So then next up is Contour TRL. So this is a deep resurfacing laser. And it basically is used again for deep wrinkles, tightening of the skin. It can have a blepharoplasty-like result on the eyelids, which is, you know, when you get surgery to remove the extra skin that starts to sag on the lids. And it, you know, it can also be used for scars, certain types of scars. This particular patient had these DPN, which are, you know, benign moles, basically growth on the surface of the skin. It's genetic, it's pretty common, especially in darker Fitzpatrick. And so he wanted to remove those bumps, and this was the easiest way for us to get all of them. So we actually went over the lids, over the eyelids and underneath the eyelids, and on the cheeks. So this picture is actually 4 weeks after. So there is downtime associated with this one, and I'm going to get into that in a minute. And it does require much more numbing and a little bit of sedation because it's a little bit, you know, more of an intense laser. So for healing, as far as BBL is concerned, it's typically about a week. We don't really call it downtime because the skin just gets mildly red and warm afterwards. Pigment does get a little bit more noticeable. You can see in the picture on the top right, it's like right after. But that pigment just sloughs off naturally as you wash your face over the course of, you know, that week, and you can wear makeup to cover it up if you feel the need. Here's some before and afters with BBL. Again, the patient with the acne, that was after 8 sessions that were 2 weeks apart. My chest there in the middle, 10 days post-treatment with just one treatment. So it only takes one to get quite a significant reduction in the brown spots. And we can do legs and arms and other areas of the body as well. With Halo healing, basically these mens, which are called microscopic epidermal necrotic debris, these are basically the skin, wherever those little channels were made with the Halo laser, where the skin purges. It's coming up to the surface and then it's coming off. So these usually appear about day 2 or 3, they start to appear. And then by the 7th day, most of them are completely gone. It feels a little bit sandpapery and rough, but aside from looking, you know, just kind of bronze all over, it really doesn't look that crazy. You can use moisturizers. And I'll get into what skincare we recommend you use with these treatments toward the end here. And we advise not exfoliating and trying to help them off. It's best if you can just let it happen naturally. So here's a couple healing journals, and the one on the left is me. That was my first Halo back in 2020. Quite a bit of sun damage came out. And then the middle there, that's the Halo that was done for acne scars on the cheek. So it was a very deep Halo, and you can see the difference in the size of those mens. They're a little bit bigger, but you can already see that fresh skin underneath coming through. And then same thing on the far right. We did a little bit more of a dense treatment on the cheeks, and all that sun damage is just coming off. So it's quite satisfying. And these are some before and afters. Just, you know, most of them are a few weeks after treatment. So you can see the brightness and reduction in that pigment, and everyone's skin looks nice and smooth and healthy. Here's some more before and afters. That's mine on the bottom left after my first Halo back in 2020. I've done it twice. I will say the second time was not nearly as dramatic, which I guess is a good thing. It means I had less damage to pull out. And then same thing, one Halo for these other 2. All right, Moxie healing, you have mild redness right afterwards, and that heat that I was talking about kind of feels like a sunburn. But this one we really say is essentially little to no downtime, because although those mens, just like with Halo, do come up to the surface, they're very, very tiny. And they're there usually from day 2 to 4, maybe 5, but they naturally just come off as you wash your face, and you can cover with tinted sunscreen or makeup. So it's pretty simple. And these are some Moxie before and afters. I showed you that top left one there with the melasma. There's another melasma on the bottom left side. And then just even pigment, just lots of scattered pigment with these other two on the top and bottom there on the right-hand side. But you get nice glowing skin. So contour. So this is the deep resurfacing laser. I put this in here because this lovely patient was kind enough to let me share her journey here. And I do not have a final outcome on this one yet because it was actually done earlier this month, but you can see just from day 1 where I know that looks pretty rough, all the way to 1 week later, how quick the healing actually is. And most people by day 4 or 5 feel human enough that they can go out in public. But I do advise people, you probably would want to take a few days off, at least. The first week would be ideal to allow for that healing. And the skin, obviously, you can see on the left-hand side how it's pretty raw and swollen. But believe it or not really painful. Very tight is how she would describe it. In the picture in the middle on day 3, she came into the office so that I could just check on her and see how the skin was healing. And I kind of wish I had recorded her. She said, she's like, I'm already so happy. And she was smiling. And I just thought that was kind of funny with her face still looking, obviously like she'd walked through a fire. But, she's very happy. And the skin's going to continue to heal even, beyond where it is now, because it continues to tighten as that collagen is formed and new skin is formed. So her eyelids will continue to tighten and everything will keep lifting. And again, this is our before and after for my patient who did the contour as well. And that's 4 weeks after. And then there's another before and after that's fully healed. So you can see the reduction in wrinkles and especially on the eye area. But that tightens and lifts everything very nicely. And I love to stack treatments together, meaning doing more than one modality at a time. Broadband light, the BBL combined with Halo and Moxie is ideal. The patient on the left here did BBL, Halo, and then we also did that contour, that deep resurfacing around her eyes. So that picture on the right there for her is 2 weeks after. So you can really see she's glowing and all the pigment had come out, and her eyelids and under eyes are all going to continue to tighten with more time. And then you can see this BBL Moxie combo here on the right. So pre and post care, just wanted to quickly touch on that. It is important that we pre-treat. So especially with darker Fitzpatrick's, if we're going to do a laser treatment like a Moxie, to get the best outcome, we do encourage patients to do a regimen to make sure the skin is as healthy as possible prior to doing it. And sometimes we will do a combination with products that will suppress the melanocytes, so it calms them down. So that means that when we do that laser procedure, we're much less likely to see that inflammatory response. So it's just a way to enhance the outcome. It's not required, but it's definitely recommended. As well as the Alastin skincare kit for pretty much everyone doing a laser, especially an ablative laser. It's a really good idea to pre-treat the skin with nectar, Alastin nectar, which is a nice serum that helps collagen stimulation. It reduces inflammation, and patients that use it before and after lasers really see a pretty amazingly shorter recovery time. The skin heals much faster and looks just that much better. So it's a really nice prep. But this kit we have has a nice cleanser that's ideal for using with procedures like this. It's sunscreens included, a moisturizer, and that nectar. So we always recommend that patients do that pre and post laser. So just to review again, with the Fitzpatrick types, I've listed here next to each one which modalities, which of those lasers would be ideal choices for these patients. So if you kind of have an idea where you think you fall in this Fitzpatrick scale, then you can kind of see what options we would probably have for you. And the ones that I starred here are the Fitzpatrick 5 and 6 next to Moxie, as well as Wash 4 as well. Those are ideal. Moxie is really the best choice. But we can do the others with, certain precautions, and, it really depends on what we're trying to achieve. For example, if someone is a darker Fitzpatrick, you can be a Fitzpatrick 6 and have acne scarring. I can still do Halo to help with that. And then you can do Moxie for the rest of the face. And, laser peels and the resurfacing can also be done for things that are deeper. So we really do have lots of options here. But that basically covers it. So I just wanted to open it up here for questions. I have this QR code here on the left. If anyone wants to schedule a consult with me, I'm happy to offer that. It's a free consult just to discuss your needs and your goals and what it is that you're trying to do. And then we can talk about, what your plan would be and go from there. So I think the chat should be open if people want to ask questions. All right, I got a lot of questions here. So, see if I'll start from the top here. All right, go Terps. I'm just seeing all that now. So yeah, which laser is best for melasma? That would absolutely 100% be the Moxie, for sure. Will laser affect your filler? No, it will not. Now, people that have, say, cheek filler, you potentially could see a little bit more swelling in the areas where you have the filler, but it will go back down. But that's just something to be aware of. How should I prepare my skin before laser treatment? The best would be those products that I just went over at the end. Sorry, I know you asked the question. Probably when I was just going through it. So I think that the Elastin kit is ideal because you have the prep with the nectar. You can use that post laser as well, but you also have the gentle cleanser. It's best to avoid retinols, glycolic acid, the strong active skincare within 3 to 5 days. So if we're doing a halo, for example, I would recommend you stop within the 3 to 5 days prior, just to give your skin that break. But nectar is ideal for prepping it as far as, getting it in the best condition possible. And it really is good to get on a good skincare regimen if you have enough time prior to doing a treatment, just to establish that barrier and make sure your skin is really in great shape. How long after Botox or Dysport should we wait to do a treatment? Ideally, I would say at least a week, but probably 2 weeks would be best. I do have some people that actually treat on the same day. But what we do is we do the laser first, and then, if you're a brave soul with your face on fire, we can sit down and do Botox right away. And some people do. It's really not that bad. But yeah, I would say it would be best to do a few weeks. How long do results last? And how can I maintain them? The results are lasting, as long as you can take care of your skin. I think we're all so much better now about wearing sunscreen. We did a lot of damage when we were younger, thought we were going to be nice and bronze, and, got way too much sun. So, as long as you wear your sunblock and use good skincare, you can certainly maintain it nicely, for a very long time. And once people do more intense laser treatments, we typically don't have to do those again. If we're talking, a deep halo or, a contour, like the resurfacing laser, you may never have to do that again. But we do recommend Moxie. You can do Moxie, annually. If you do that once a year, you're just maintaining your skin, and they're really easy to do. As far as how often would you need a contour treatment? Again, that's more of a one and done situation, hopefully. Not that you couldn't do more if you felt the need, but I think most people that do a deep resurfacing like that should be fine after that, and would not need to go quite as intensely again. If you do want to do more than one, the best thing to do is, allow for the full healing time. So if you've done a halo, for example, you're going to see your results within, the 7 to 10 days. You're going to see that improvement in the texture and the pigment, but the full effect takes months, for the skin to fully regenerate. So I would wait, until you see that. If we're talking about Moxie and we're getting rid of something like melasma, the best method is really to use skincare, prep your skin, and do a Moxie treatment, but then wait approximately 6 to 8 weeks. I think 6 weeks is a good time frame before doing another one. So it really kind of depends on the treatment we're doing, but the Moxie is the only one I think that I would do, probably that close together. Halo, most people wait months, 6 months to a year plus before they would do another one. Broadband light can be done as frequently as every 2 weeks. That doesn't really require healing. It's not breaking the skin. So that's, just whenever. I have a lot of patients that like to do that quarterly, maybe when they do their Botox, kind of on the same schedule. I always tell people that doing broadband light is kind of like dipping your toe in the fountain of youth. Every time you do it, you're going to get that little reversal of skin age. So you're brightening, you're getting collagen, it's, redness reduction, all of it. So that one can be done quite often. If you're scared to do the deep treatment, like contour, could Moxie get you the same results over time? No. I think, with Moxie, repeated Moxies, you'd see improvement in collagen, you'd see reduction in pigment, brightening, but nothing is going to be quite that productive. So contour it's resurfacing. So I'm taking, quite a bit of skin each time, and that's really going to generate new skin. So we're giving you new skin. And remember, the Moxie and the Halo are fractional lasers. What that means is we're hitting a fraction of your skin. So in any moment when we do that treatment, we're only going to get that treatment on that portion. Ablative lasers, fully ablative lasers, like a resurfacing, you're taking that entire layer. So it's just going to be that much more impactful with that one treatment. But I don't want to tell anyone they shouldn't do multiple Moxies. I mean, you definitely would see a lovely result with lots of smoothing and improvement, even if, you don't feel you can do a full ablative one. Oh, and yeah, sorry, with the consult, setting up a consult, someone mentioned from the QR code, I would set it up as a consult. I should say aesthetic consult. This should be an option. If you select BBL, consults, that's fine too. We can fix that. But if as long as aesthetic consult is under there, I think you have to scroll down toward the bottom of the options. But that would be what you could set up so that we know you just want a consultation. How long after laser treatment can I get a hydrofacial? I think it's actually great to do after a laser. I would say probably a week to 2 weeks after. The first week, I wouldn't want you to do anything really other than gentle cleanser and moisturizing and stuff. But if you want to help the men's off at the very end and, get hydration and everything, a hydrofacial would be great, actually. Is there a charge for consultation? No charge. Someone says, I'm scared. What are all the pain management options? So I completely understand the fear. It's not that bad, believe it or not. So the broadband light, you don't need any numbing. We don't do any numbing for that at all. But for Moxie and Halo, we do numbing cream. We apply it for an hour. So we apply it, and you can sit in our lounge and just relax. And then we wash that off and we do the treatment. If we're getting into the deeper resurfacing lasers, then we can bring in what we need as far as, I use Pronox for that, the laughing gas. You can have a Valium, we can, and I do injection numbing. With that one, it would be lidocaine. It's basically done like a block, so that you can numb the entire face. You don't want to feel that one. And afterwards, not that bad, believe it or not. It's really not that bad. So I think I've gotten through my questions. The lounge is so comfy. Yeah, it is. Oh, how long do they take? That's a good question. So I think broadband light I mentioned is about 20 to 30 minutes. The Halo takes about, well, it's an hour for numbing, and then the procedure is about a half an hour. Moxie, again, after numbing is literally less than 10 minutes. And the ablative one, if we're doing a resurfacing, now I can do that only on, also, I never mentioned this, I can do just the eyes only. Some patients opt for that. If we're looking, to tighten up lids, I'm actually going to have that done personally. In, I don't know, I was supposed to do it a month ago, but I'm going to be doing that soon, not to myself, to tighten up the lid skin there. So that would be faster, obviously, than doing the entire face, but we allow 2 hours for that one for numbing time and the laser itself. So just depends length of time, but most people it's between an hour and 2 hours. Is there financing available? Yes. So we take care credit, and we also have options for payment plans like Cherry. So it's a way to just spread it out, over time, with 0% interest. So yes, we do. I'm bummed I didn't get laughing. Oh, you know what? I'm sorry. We don't do laughing gas for everybody with, Halo and stuff typically, because we don't always need it if you're not real anxious. But yes, we have it if you need it. If you need a little something to take the edge off. So any other questions? Hopefully I covered pretty much everything. But yeah, I'm again happy to do a consultation. I try to talk to patients about these options, when you're there for other things, and we go over, the Botox and other stuff we're doing, but it's a lot to fit in. So, and can I do these treatments any time of year? Yes. So ideally, Moxie is the year-round laser, and then the others we just, make sure you understand the need to be just a little bit more diligent. Wear a hat if you go outside, and wear sunscreen, and don't do it right before you're going to the beach. But yeah, you can do them any time of year. Do we have any laser specials right now? Currently. No, however, anyone who attended this webinar is going to get $100 off voucher for any laser treatment. So we have that. And then, there will be specials from time to time that pop up for, various things like the holidays and stuff. But as of right now, I don't believe there are any out there currently other than that, other than the $100 off. Anything else? I am, excited for people to start doing this. I think if you ask me which one would probably be my favorite laser, I would say probably the Halo, due to its versatility. But now that I really have been able to see more and more what the ablative laser can do, it's pretty exciting. So it obviously you need to know what to expect and prepare for a little bit of downtime, but the outcome is definitely worth it. So I think that's something that people should really think about. So all right, well, thank you everybody. I appreciate you joining me and for all the great questions, and I look forward to seeing you all soon. Okay, good night.
Thanks, Jen. Good night.
Great job, Jen. Thank you.
Thanks so much.
Okay. That was good.